We are covering health maintenance organizations, or HMOs, for your health insurance licensing exam. The two defining features you must know for the exam are that HMOs operate on a prepaid basis and use a primary care physician, or PCP, as a gatekeeper. Prepaid means the member pays a fixed monthly premium and in return receives comprehensive health care services with a strong emphasis on preventive care. The gatekeeper concept is even more critical for test day. A member cannot simply decide to see a cardiologist. They must first visit their PCP, who then provides a referral to an in-network specialist. An exam question might ask, what happens if a member self-refers to a specialist? The answer is, the claim will be denied. This leads directly to the strict network rules. HMOs require members to use providers within their established network. If a member goes to an out-of-network doctor for a routine physical, the HMO will not pay. The only time an HMO will cover out-of-network services is for a true medical emergency. Be very careful with the wording on the exam. A question about a life-threatening injury while on vacation would be a covered emergency, but choosing to see an out-of-network provider for a non-urgent second opinion would not be covered. Let's consider an exam-style question. A member of an HMO is unhappy with their in-network dermatologist's diagnosis and sees a renowned out-of-network specialist for a second opinion without a referral. Will the HMO cover the cost? The answer is a clear no. The member violated both the gatekeeper rule and the in-network requirement. The exam will also expect you to know the different HMO models, which are primarily based on the HMO's relationship with its physicians. The staff model is the most restrictive. The physicians are actual employees of the HMO and work in HMO-owned facilities. The group model involves the HMO contracting with one independent, multi-specialty group that provides services to members. The most flexible and common model is the Independent Practice Association, or IPA model. Here, the HMO contracts with a network of independent physicians who practice out of their own offices. A common trap is confusing HMOs with PPOs. Remember, PPOs offer more flexibility. They don't have a gatekeeper requirement, and they provide coverage for out-of-network services, although at a higher cost to the member. If you see gatekeeper or referral required, your mind should immediately go to HMO. To remember the core of an HMO, think of the phrase, "Get a pass, stay in the castle." Get a pass reminds you that you need a referral or a TAS from your PCP gatekeeper. Stay in the castle reminds you that you must stay within the network or the castle walls for coverage. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.